A very good morning to one and all. This is Dr. Jyotirmay, consultant gynecologist and fertility specialist from Avira Hospital. So today we are going to discuss about the importance of the follicular scans. So follicular scan is done by the transvaginal ultrasonography, which we generally call it as a TVS. Follicles are nothing but the fluid-filled sacs which are present in the ovary, and they contain the egg or the oocyte. So during each cycle, what happens is about 10 to 15 follicles are being recruited in each ovary. Among these 10 to 15 follicles, one follicle will be growing in the size and then it ruptures, and it will aid in the release of the egg or the oocyte. And during this time, the sperm should be available so that the fertilization will take place. So the time of ovulation, we call it as a fertile period. Among a woman with 28 days cycle, the fertile period ranges between 13 to 15 day of the menses. So as the menstrual cycle duration changes, the fertile period also changes. So by doing this follicular scans, we can know the fertile period so that the woman can meet with the husband and have a successful pregnancy. So the follicular scans are being done from day 2 or day 3 of the cycle, and the next scan will be on day 9 or day 10 of the cycle, and subsequent scans will be on alternate days till the ovulation occurs. So what we are going to see on the day 2 scan is that if there are any cysts in the ovaries, we can find out on the day 2 scan. So depending on the size of the cyst, also the treatment varies. And if there are any tumors in the ovaries, we can be identified on the day 2 scan. So not only that, even the ovarian reserve, that is the number of follicles which are present in the ovary, can be determined on the day 2 scan. So if the number of follicles are normal, we will be subsequently doing the scans on day 9 till the ovulation occurs, and we will be guiding the woman to have the intercourse during the time of ovulation, which will increase the chances of pregnancy. If the number of follicles are more in number on day 2 scan, we call it as a polycystic ovary. So if there is a polycystic ovaries, there will be problem in the growth of the follicle and also ovulation. So depending on the number of follicles, as I told you, like in polycystic ovaries, so we can give some ovulation induction drugs from day 2 of the cycle itself. So the follicular scans will help us in determining the treatment course of the patients. And not only that, if the number of follicles are very less in number, then they have to go for the IVF treatment. Not only this, if there is any problem in the ovulation also can be determined by the follicular scans, and we can give the required drugs for the ovulation. If the patient is on IVF treatment, we can know the response to the IVF treatment, and we can change the drugs, and even the trigger can be also determined by doing this follicular scans. If there is any problem in the semen parameters, and if you are planning for IUI, by doing this follicular scans, the timing of IUI can also be determined. So this is the importance of the follicular scans. Not only this, even the endometrial lining can also be determined. So not only the follicular growth is important for the successful pregnancy, even the endometrial thickness is also important. So whenever we are doing the follicular scans, in part we will be seeing the endometrial lining, and if there are any abnormalities in the endometrial lining, can also be determined by doing this follicular scans. So we advise, like if the couple are married for more than 1 year and are unable to achieve the pregnancy, kindly consult a gynecologist. So we are here to help you in by doing the follicular scans and getting a successful pregnancy. Thank you.